We hear people using severe headaches and migraines interchangeably.
Oh yeah. I have actually seen my patients talking about migraines to mean severe headaches. Yeah.
But is that true though? So today we are going to find out more about headaches. But before we continue, please make sure to subscribe to our channel. Also make sure to hit that notification bell so that you're notified every time we upload a new video.
Yeah.
Make sure to also like, and please make sure you comment. And let's get into the video.
So everyone at a point in their life has heard about headache, and there are very many types of headaches. But broadly, headaches are classified into primary headaches and secondary headaches. In primary headaches, basically the headache is the problem. But on the other hand, secondary headache means it's secondary to something, that something is causing this headache. So today we are really measuring on headache as a primary thing. So we have three major types of primary headaches, which include, but not limited to,
we have the tension headache that people mostly confuse for migraines.
Exactly.
Yeah, we have migraines as itself as part of primary headaches. We have cluster headaches. Yeah, we have so many types.
So to start with, tension headache is the most common type of headache we have. So what does it feel to have a tension headache? Tension headache, it feels like there is a strong band, a tight band around your head. Yeah, just you feel like it's something that is wrapped around the head. The head is very tight, and of course this type of headache is not as severe. Mostly it represents moderate intensity headache, right? And it mostly occurs on both sides of the head. It can be associated with photophobia, that is fear of light or even sound. So this type of headache can sometimes be associated with some pain around the neck and even the shoulders. But of course, if the pain around the shoulders and neck is severe or there is some stiffness, that's a different story. We go to the next type of headache, which is migraines. Yeah, I know you are excited to know about migraines. More often than not, it's severe in nature. It is usually on one side of the head and is associated with, most importantly, nausea. So you feel like vomiting. The pain is usually characterized by its throbbing, something like a heartbeat. So migraines are also associated with photophobia, that is phobia to light, and also phobia to sound, on top of the other associations such as nausea and vomiting.
So something else that I think it's important for us to know about migraine headaches is the fact that you cannot diagnose yourself with migraine headaches.
Yeah, sure.
Migraine headaches are a clinical diagnosis. It is a diagnosis that must be made by a medical practitioner.
Exactly.
So you can't just have a severe headache and start thinking you have, migraines.
Yeah. So then next we'll talk about the third most common type of headache, which is cluster headache. So cluster headache is also known as suicidal headache, and this headache is usually felt like it's behind the eye or is around the eye, or sometimes can just be around one place, on the sides of the headache. Yeah, and it's usually associated with tearing. Sometimes it can be also associated with nasal discharge. And of course, when you have this type of headache, you will be really restless. Yeah? Again, most importantly, this type of headache is usually cyclical in nature, meaning that it has a particular pattern. Like, for example, it has a consistent timing, can occur, or you can have this type of headache almost every other morning. Every morning you have this type of headache. And that gives its nickname, alarm clock headache.
There are so many types of headaches. For example, because of changes in the hormones during a menstrual cycle, you might get what we call hormonal headache. Okay, If you have a flu, you might get a sinus headache because your sinuses are either blocked. You get a or inflamed. You get a kind of headache around your forehead, behind your nostrils. You feel that kind of pressure and pain around those areas. So headache can really be caused by so many things, and so there are so many types of headaches that we might not even be able to talk about all of them here today. Now that you know the types of headaches, what are the things that will cause these headaches? The most common causes are, dehydration. When you don't take enough water, you might find that the primary symptom that you get is a headache. So we normally encourage us and people, to take at least 8 glasses of water minimum in a day. Other causes may be related to low blood sugar levels. When you've not eaten for a long time, if you space meals too much, then you might find actually that you run low on your blood sugar levels, and therefore the primary symptom that is most likely to manifest would be headaches.
If you deprive yourself of sleep, you are likely to get fatigue and consequently headaches. We also have stress, especially anything that is stressing you psychologically, keeping your mind working and working and working, will ultimately lead to a headache.
And also there are so many things really that can cause headaches. Infections of whatever kind. If you have say a bacterial infection or a viral infection of really any parts of your body, it can cause you to have a headache.
Having known what are the causes, or rather what will bring an headache to you, it's important that we know about what are the red flags about a headache. If you have this this sign with headache, it's important for you to take a course of action almost immediately. So some of the red flags will include a type of headache known as thunderclap headache. It's like a headache that starts all of a sudden, and it is severe, and it starts to increase in its intensity over time. Most importantly, this type of headache will not respond to conventional treatments such as normal painkillers. If you have this type of headache, it's important to seek medications ASAP. Another red flag about headaches is when this headache is associated with neck stiffness and even fevers. If your headache is associated with neck stiffness and fevers, and decreasing levels of consciousness, this would indicate something, an infection of the covers of the brain called meningitis. And when you have this, is a deadly infection, and you should seek medication as soon as possible. In case of a new onset headache in someone who is immunosuppressed, when we are talking about an immunosuppressed person, is when their immunity is compromised. We are talking people who have issues to do with HIV, people who have diabetes, or even cancers. These are people who are actually immunosuppressed. For example, if someone is HIV positive for that matter, and they develop a new onset headache, it's very important for them to seek, or rather to visit their, where they always get their medications and where they are on follow-up, because there's a type of, in meningitis, or rather an infection within the covers of the brain called cryptococcal meningitis. It's actually a fungal infection, and it's usually deadly when it comes to these patients.
So another red flag that you might get when you have a headache, or rather a red flag that one might get, is having one-sided weakness. What I mean by one-sided weakness is you know, you have a headache and then all of a sudden you start, you know, to feel like one side of your body is paralyzed, you know, like you can't see very well using one eye, or and that's one eye is actually producing a lot of tears. You feel like you can't really do anything with the limbs of that affected side, meaning that your hand and your feet can't really actually work well. That is a very big red flag, and in case that happens, you must visit the healthcare provider as soon as possible. So, you know, prevention is always better than cure, right? It is a very common saying, and everyone actually knows that. So you drink a lot of water, 8 glasses per day. That is the minimum, the bare minimum. You know, you can take as much as you can actually. But just avoid getting, you know, we have also water intoxication, right? So drink 8 glasses of water minimum.
That's approximately 3 liters in a day. You should also get involved in exercise regularly. Ensure that you eat healthy and avoid, you know, spacing your meals. So that your blood sugars do not go down and cause a headache.
Also make sure that, you know, you have enough sleep, enough adequate quality sleep. You know, 6 to 8 hours is enough, but make sure that you're having a restful sleep,
a quality one. You should also ensure that you also avoid you know, stressors, anything that is stressing you. You know, learn how to deal with your stress adequately and promptly to ensure that this does not, you know, ultimately lead to a headache. You should also take, most importantly, and this one affects many people, especially those in this digital era, those who are using computers. Ensure that you take regular breaks from your computers, to ensure that you are not straining your body in you know, so much to cause a headache.
In case you have a headache and you feel like, you know, you have some kind of tension around your neck and your shoulders, then it is actually really beneficial to use ice packs. If you have an ice pack, you can actually use an ice pack. If you don't, then you can just regular water, dip a piece of cloth inside it, and then use it to, you know, to sponge around the neck and shoulders. But please do not confuse that for neck stiffness. If you have neck stiffness, then it is important for you to visit your healthcare practitioner. And also about management, over-the-counter medications do just fine. So whenever you have a headache, you've eaten, you've slept, you've drunk a lot of water, it's still not going away, it is actually, you know, you can actually take painkillers for that matter. You know, aspirin, paracetamol, all the other NSA drugs, you know, diclofenac, brufen, they can actually really do well for your headache.
But again, ensure that you don't regularly decide to use painkillers, especially these NSAIDs such as diclofenac and brufen. They really have, you know, continuous and chronic use of these painkillers really have a lot of do harm to your stomach. It can actually cause gastritis and even the peptic ulcer diseases that we, you know, many people have.
And in the case that you feel that your headache is really recurring a lot, then it is very important to talk to your doctor so that they can establish what could be the cause of that. So up to that point, I really hope that now you know the difference between tension headache and migraine headaches. And if you need more clarification, please let us know in the comments. But thank you so much for staying with us till the end of this video. And we hope to see you in our next video. Bye!